Core functions of epidemiology. There are 6 major tasks of epidemiology in public health practice. 1. Public health surveillance. 2. Field investigation. 3. Analytic studies. 4. Evaluation. 5. Linkages. 6. Policy development. Public health surveillance. Public health surveillance is the ongoing, systematic collection, analysis, interpretation, and dissemination of health data to help guide public health decision-making in action. Surveillance is equivalent to monitoring the pulse of the community. The purpose of public health surveillance is to portray the ongoing patterns of disease occurrence and disease potential so that investigation, control, and prevention measures can be applied efficiently and effectively. Field investigation. Surveillance provides information for action. One of the first actions that results from a surveillance case report or report of a cluster is investigation by the Public Health Department. The investigation may be as limited as a phone call to the healthcare provider to confirm or clarify the circumstances of the reported case, or it may involve a field investigation requiring the coordinated efforts of dozens of people to characterize the extent of an epidemic and to identify its cause. The objectives of such investigations often lead to the identification of additional unreported or unrecognized ill persons who might otherwise continue to spread infection to others. Investigations may identify a source or vehicle of infection that can be controlled or eliminated. By identifying the vehicle, investigators may be able to determine how many other persons might have already been exposed and how many continue to be at risk. Investigation may simply be to learn more about the natural history, clinical spectrum, descriptive epidemiology, and risk factors of the disease before determining what disease intervention methods might be appropriate. Analytic studies. Surveillance and field investigations are usually sufficient to identify causes, modes of transmission, and appropriate control and prevention measures. But sometimes analytic studies employing more rigorous methods are needed. Often the methods are used in combination with surveillance and field investigations, providing clues or hypotheses about causes and modes of transmission, and analytic studies evaluating the credibility of those hypotheses. Clusters or outbreaks of disease frequently are investigated initially with descriptive epidemiology. The descriptive approach involves the study of disease incidence and distribution by time, place, and person. It includes the calculation of rates and identification of parts of the population at higher risk than others. The hallmark of an analytic epidemiologic study is the use of a valid comparison group. Epidemiologists must be skilled in all aspects of such studies, including design, conduct, analysis, interpretation, and communication of findings. Design includes determining the appropriate research strategy and study design, writing justifications and protocols, calculating sample sizes, deciding on criteria for subject selection, choosing an appropriate comparison group, and designing questionnaires. Conduct. Conduct involves securing appropriate clearances and approvals, adhering to appropriate ethical principles, abstracting records, tracking down and interviewing subjects, collecting and handling specimens, and managing the data. Analysis. Analysis begins with describing the characteristics of the subjects. It progresses to calculation of rates, creation of comparative tables, and computation of measures of association tests of significance like chi-square test, confidence intervals, and the like. Many epidemiologic studies require more advanced analytic techniques such as stratified analysis, regression, and modeling. Finally, interpretation involves putting the study findings into perspective, identifying the key take-home messages, and making sound recommendations. Evaluation is the process of determining, as systematically and objectively as possible, the relevance, effectiveness, efficiency, and impact of activities with respect to established goals. Effectiveness refers to the ability of a program to produce the intended or expected results in the field. Efficiency refers to the ability of the program to produce the intended results with a minimum expenditure of time and resources. The evaluation itself may focus on plans, formative evaluation, operations, process evaluation, and impact, summative evaluation. Linkages. Epidemiologists working in public health settings rarely act in isolation. During an investigation, an epidemiologist usually participates as either a member or the leader of a multidisciplinary team. Other team members may be laboratorians, sanitarians, infection control personnel, nurses or other clinical staff, and increasingly, computer information specialists. Policy development. Epidemiologists should stick to research and not get involved in policy development or even make recommendations. Public health epidemiologists do not have this luxury. Epidemiologists working in public health regularly provide input, testimony, and recommendations regarding disease control strategies, reportable disease regulations, and healthcare policy.